Hey everyone, welcome back to the NPTE podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. And if no one has said thank you to you today, let me be the first to say thank you. Thank you for the efforts that you're putting into this, all of the time, energy, and really all the emotional drain that comes with preparing for the NPTE. Let me tell you, it's worth it. Once you get to the other side, you've got cash positive where you get an actual job where you're earning money rather than just paying for the opportunity to work for somebody else. It's a great career path. It's something that I continue to enjoy practicing in, and I would just encourage you along this path that it really is the intersection of your interest and your skill. So just remember that as you're going through the content, try to use that curiosity that you have to try to find why things are occurring, and you'll find that turns into not only a useful exercise for preparing for the exam, but it's also helpful for your patients down the road. So you can explain to them why things are occurring, how things are occurring, what the mechanism is, and that patient education is essential to that rapport that you have with your patients, with the caregivers. So I would just encourage you along this path. So today we'll be going through a practice question related to the gastrointestinal system. So as you recall, the gastrointestinal system just has a handful of questions. This is part of the other systems on the exam. In this podcast, we are trying to go through each of the systems on the FSBPT's published content outline so that you don't have any surprises on test day about the content, scope of material that is likely to be tested on test day. Also of note, as I'm creating these questions, I use the source material, so we're using like Goodman's Pathology, we're using Physical Rehabilitation by O'Sullivan, we're using McGee, Dutton, all of your core PT textbooks. I would also encourage you don't get rid of those quite yet. Wait until you get through exam day so that you can use those as reference during your preparation. So today we've got a practice question related to the gastrointestinal system. There are somewhere between 3 and 7 questions related to this. But before we get to that, just a quick reminder, be sure to check out ptfinalexam.com/podcast for all of our giveaways and cheat sheets. You can find all of that content over on ptfinalexam.com/podcast. And we do have ongoing courses. So if you need a robust course to get you through the NPT, we have options to fit all budgets. Be sure to check us out over at ptfinalexam.com. All right, so here we go with our practice question for today. Again, those of you watching the video version of this over on YouTube, you'll be able to follow along. Otherwise, I will read you the question, pause for your response, and then we'll talk about it together. Diverticulitis is most often manifested by chronic abdominal pain, and which other signs and symptoms? So diverticulitis is most often manifested by chronic abdominal pain, and which other signs and symptoms? So we have 1, left lower quadrant pain, vomiting, and anorexia. 2, left upper quadrant pain, belching, mid-thoracic pain. 3, right lower quadrant pain, ascites, clay-colored stools. And 4, right upper quadrant pain, nausea, asterixis. So again, left lower quadrant pain, vomiting, anorexia. Left upper quadrant pain, belching, and mid-thoracic pain. Right lower quadrant pain, ascites, clay-colored stools. And 4, right upper quadrant pain, nausea, asterixis. So this question asking about diverticulitis, this is when your colon forms diverticula. So these diverticulae, these are small like diversions. So you can see it in the root of the word diverticulus. The diversion means you get these pockets or bubbles where the mucosal and muscular membrane around the colon creates a small abscess or bubble. Now what happens is that stool and food can actually get caught in these, creating an infectious process. So you can go from inflammation to infection quite quickly with diverticulitis. Very often these cases are self-managed or even possibly asymptomatic if they're small enough. However, they can grow to be quite burdensome to the patient. And so the most frequent manifestation would be left lower quadrant pain, vomiting, and anorexia. So option number 1, left lower quadrant pain, vomiting, anorexia. Included with this list would be fever, change in bowel or bladder movements, especially bowel habits, but it can affect the bladder because of its proximity to bladder, nausea, vomiting, anorexia. And then the other thing that frequently occurs is that you can get retroperitoneal abscesses and peritonitis occur as a result of the infectious process in the diverticulae. So all things considered, diverticulitis, this is a very vexing problem for those who who get it. And one of the things that's, as far as what leads to it, I mean, certainly once you get into the sixth and seventh and eighth decade of life, so patients above 60, other things that would be included here would be chronic use of steroids. This can cause it, as well as Goodman lists constipation, physical inactivity, red meat, obesity, smoking, NSAID use, all this, as well as some genetic conditions like Ehlers-Danlos syndrome, Marfan syndrome, scleroderma. All of these can create a propensity for diverticulitis. And so the classic presentation of diverticulitis is to have that chronic abdominal pain combined with left lower quadrant pain, vomiting, anorexia. Now, it can extend really anywhere on the colon, so it doesn't always have to be in the left lower quadrant. I believe in Asian countries, it's more in the right lower quadrant. But point being that it's typically along the colon, ascending, horizontal or transverse, descending, and sigmoid colons. It can extend as far as the small intestine. These other options include, so left upper quadrant pain, option 2 is incorrect because that's the classic presentation of gastroesophageal reflux disease, where you have left upper quadrant pain, mid-thoracic pain, belching, all that related to the stomach and stomach acid. And then the other options include liver type symptoms, which are typically on the right side of the body. And that includes ascites. That's where you have a buildup of peritoneal fluid because the hepatic portal system, so in the liver, you start to get poor blood flow, creating a backup of fluid. So you've got ascites, or however you want to say that. That's the way I classically hear it said. It's spelled a little bit funny, but ascites tends to be a classic pronunciation there. Clay-colored stools, this would be if you lack the production of bile, you get a lighter colored stool. So rather than a dark colored, you get a lighter colored stool, that clay colored stool, often associated with liver disease, cirrhosis of the liver, liver toxicity, jaundice, all of these things associated with liver type impairments. And then that final one is nausea and asterixis. Asterixis, this is called liver flap, associated with liver buildup, or ammonia buildup associated with liver dysfunction. It's where you get a clonus of the wrist that it's tested by pushing the wrist into rapid hyperextension, and it creates a clonus or a flapping motion, often called liver flap. And so asterixis, again, associated with the liver. So therefore, the correct answer here is that left lower quadrant pain, vomiting, and anorexia. These are common symptoms along with chronic abdominal pain associated with diverticulitis. So diverticulitis, again, something that could occur in patients who have really any of these genetic conditions like Ehlers-Danlos, Marfan, scleroderma. It could also be associated with what we would consider the very, very much lifestyle and diet considerations when you look at physical inactivity, constipation, red meat consumption, obesity, smoking, NSAID use, and like I said, the chronic steroid use. So there you go. There's your question about the gastrointestinal system. And again, considering back on the patient caseload I've only had a handful of patients with active or acute diverticulitis. It can be benign in the sense that it can be asymptomatic. I mean, certainly it's not ideal, but it is something that can occur fairly frequently with patients and clearly requires further medical workup. But you as a PT, your job is to make appropriate referrals when necessary. Make sure you're communicating with the primary care physician, all that to make sure that you are a good part of the interdisciplinary team. So with that, we'll bring today to a conclusion. As always, thank you so much for listening and being a part of the NPTE podcast. If you haven't yet, please be sure to leave us a quick review over on Google Play, iTunes, Spotify. It really only takes a second. Just head over there. It helps us out so much as we are trying to get the word out. And in the meantime, be safe. Have a fabulous day. Happy studies. Will Crane fist pumps all around. And I'll catch you in the next episode. Thanks.